Those deemed most at risk are being offered a booster jab, with a third dose now being advised. What are the most common side effects reported as per a clinical trial? Pfizer booster jabs. According to a clinical trial, pain at the injection site was the most commonly reported reaction after receiving the booster. Roughly 83% of the trial's booster recipients reported pain. Fatigue was the next commonly reported side effect, with around 63.7% of people reporting the side effect. This was followed with headaches for around 48.4% of participants. High cholesterol symptoms, 2 warning signs when your feet are put up. Other side effects recorded in the booster trial also fall in line with symptoms documented after the primary Pfizer series. These included muscle and joint pain, chills, diarrhea, vomiting and fever. Pfizer's trial found that, compared to adults aged 18 to 55, adults 65+ were less likely to experience fatigue or flu-like symptoms after receiving the booster. High cholesterol. Dr. names and shames worst foods. Tips: do you have coronavirus? The top symptom in fully vaccinated. Insight: the 2-minute exercise to lower blood pressure. Advice: co-chair of Mayo's Clinic COVID-19 Vaccine Allocation and Distribution Work Group, Dr. Melanie Swift said these side effects were not surprising. Most of the side effects are not a result of the vaccine, directly, but rather an indication of your immune system reacting to the vaccine, she added. Meaning, the more robust your immune response is, the more side effects you're going to have. Moderna booster jab for adults 65 and older. Pain at the injection site was the most commonly reported symptom, affecting 76% of trial participants. This was followed by fatigue, 47.4%, muscle aches, 47.4%, headache, 42.1%, and joint pain, 39.5%. Chills, nausea and vomiting were also recorded. Are you eligible? Booster vaccine doses will be available on the NHS for people most at risk from COVID-19 who have had a second dose of a vaccine at least 6 months ago. This includes people aged 50 and over, people who live and work in care homes, frontline health and social care workers, people aged 16 and over with a health condition that puts them at high risk of getting seriously ill from COVID-19, people aged 16 and over who are a main carer for someone at high risk from COVID-19, people aged 16 and over who live with someone who is more likely to get infections, such as someone who has HIV, has had a transplant or is having certain treatments for cancer, lupus or rheumatoid arthritis.